An urgent new warning about potentially fake weight loss drugs. Manufacturer Eli Lilly sounding the alarm on med spas and compound pharmacies for making versions of Mounjaro and Zepbound that could be dangerous. We think it's important to point out here that the popularity of weight loss drugs, a Kaiser Family Foundation health poll found that 1 in 8 American adults have used these medications. That's 1 in 8. Joining us to unpack the claims that non-FDA versions are dangerous is internal medicine specialist Dr. Frank Conditessa. Dr. Frank, Eli Lilly says that tested compound weight loss drugs they tested them and they found bacteria, impurities, or even a completely different chemical structure. In Chicago, a man reportedly slipped into a coma because his weight loss drug had insulin, which, as you know, can be deadly to non-diabetics. So is compounded semaglutide even safe?
Well, good evening. It's great to be with you. That's a complicated question. The answer is sometimes it is and sometimes it isn't. It really depends on the source, where you're getting it from. I kind of want to do just a very brief informational spot for just people to understand. These are diabetes treatment drugs. They were not designed for weight loss. It just happened to have a happy side effect that people took them happened to lose weight. So I think they're actually quite effective weight loss diabetes drugs. But when people use them exclusively for weight loss, particularly the cosmetic weight loss, 10 pounds, 15 pounds, I think you have to be a little bit more careful. You should go through a board certified physician. I would be careful with some of these med spas that advertise this because you don't know where they're getting their products from. And even if you go to a doctor like me who does this out of an office, a regular medical office, you have to be careful because it's hard to get it from even a pharmacy. So, and it's because of the rise of the people using it for weight loss, it's difficult for the diabetics to get it. You also have to differentiate between some of these med spas and a traditional compounding pharmacy, who I think the record is better, where you can actually go to this pharmacy. They should be local. I'd be careful about shopping online for these things. But if you can find a local establishment that you can meet the owner, walk in, see the place, ask to see their accrediting certificates, because a reputable place will be accredited and certified by certain organizations, for quality standards.
Can you break down for us just basically what's the difference between an FDA-approved weight loss drug and a compounded one? Because we're hearing now about these compounded ones.
So when you talk about a compounded drug, they are supposed to have the exact same component. So there's a pharmaceutical component, the drug, the actual drug that's going to have the pharmaceutical effect. But then there's fillers. So these are actually injectable drugs. So they're going to dissolve. Basically, it comes in a powder. So a compounding pharmacy will buy this bulk in powder. It'll come in a big jar. And then they will measure out and mix that powder with some solvent, and then create the solution that will be injected. That can be done properly, meaning done under sterile conditions and standards of purity. And if that's accomplished, then it should be identical to the FDA-approved drug that comes from a pharmaceutical factory. But the problem is that a lot of these places, they don't take the time, they don't take the effort to maintain standards. You can become contaminated with bacteria, as you mentioned. And who can blame Eli Lilly for going and testing these things and saying, hey, look, you should get it from us because these are dangerous. I can't blame them for doing that, of course. But there are ways to find it if you do your due diligence.
So according to the National Association of Boards of Pharmacies, there's more than 40,000 online pharmacies that are operating illegally. Do you think that people should avoid getting these kinds of things from online at all entirely?
I do. Because a lot of these things, it's just a phone call with either a nurse practitioner or a physician who's doing this part-time. They're going to ask you a couple of questions. They don't know you. They don't know the patient. They don't know your history. They don't know your kidney functions. And I certainly wouldn't trust somebody on the phone to prescribe me a fairly heavy-duty medication. I think people should understand these are heavy-duty drugs. And yes, they can be safe and effective. But I'm very selective about the patients that I prescribe these drugs to. Somebody who comes to me and says, listen, I need to lose 10 or 15 pounds. My first reaction isn't going to be to write them a prescription for one of these drugs. I'm going to actually try to talk them out of it first and try to teach them to exercise and to improve their diet before I start injecting them with a fairly heavy duty drug. And these have side effects. It's not a free lunch.
Right. And even with all of these warnings as you're giving them, people are still desperate, as you know, to lose weight. If they want to get a compounded version of these weight loss drugs, how can they do it and ensure that they're safe?
Well, as we said before, I would avoid doing this online. I would search up a local establishment pharmacy. I would walk in there. I would speak with the pharmacist, speak with the owner, say, can you tell me about your establishment? Can you tell me who you're accredited with? Because there are organizations of pharmacists that will actually certify these people, and they will periodically test their products to make sure that they are pure and safe. So I would find a local place, walk in there, see what it looks like. Does it look like a fly-by-night company? Have they been there a long time? Is it clean? And if you do your due diligence, and I have a local pharmacy, I practice in Florida, and I have a place that I know the owner, I've met with the people, and I'm using that with some of my patients who are having trouble getting it, even the diabetics, because it actually can be cheaper and it can be up to half the price. But I feel comfortable using this particular establishment because I've done the due diligence.
Very important information. Thanks so much, Doctor.